Around.
The ABC10 News at 6:30 starts right now.
I'm Mike Duffy.
And I'm Madison Wade. Tonight we are starting our show standing further apart, practicing social distancing. And we're going to be spending most of the show separate, getting answers to your questions. We have Dr. Tom Hopkins here with us to answer your health questions. And Lori Levy from the State Economic Development Department is here to help people who are out of work or unsure about what happens next. Please text us your questions to us at 916-321-3310. We will answer as many as possible the next half hour. But first, here are some big headlines you might have missed but need to know.
Unprecedented new steps here in California. The Bay Area is telling everyone in 6 counties to shelter in place for the next 3 weeks. Almost 7 million people told not to leave their homes except for the essentials. This applies to the following counties: Santa Clara, Marin, Alameda, San Francisco, Contra Costa, and San Mateo.
We know we need to do this, and we know we need a regional approach. We all must do our part to slow the spread of COVID-19 and ensure that our essential services remain intact and open, most especially our hospitals and healthcare facilities.
Public health leaders say everyone must stay home except to get food, care for a relative or a friend, see a doctor, or go to an essential job. They say you can go out for walks, but not in a group. Dramatic new steps being taken to stop the spread.
And the White House announced dramatic new steps today to slow the spread of the virus in the U.S. The president is telling people to drastically limit where they go and change their plans to prevent more people from getting sick.
Avoid gathering in groups of more than 10 people. Avoid discretionary travel. And avoid eating and drinking at bars, restaurants, and public food courts.
The president says everyone, especially the elderly, should stay home as much as possible. He says that schools should cancel classes. Most schools in California already have done that. And he says non-essential travel should be avoided in our area. Restaurants have been told to cut occupancy in half. Bars and wineries are outright closing.
Here in our area, a second person in Sacramento County has died because of the coronavirus. Just hours ago, Sac City Unified School District confirmed the death of a substitute teacher. The county has 33 cases in total. Placer County has 8 confirmed cases. Stanislaus County announced a 3rd case today, and Nevada County has its 1st. We will continue to see these numbers go up as more people get tested.
And now it's time to get to your questions. So many of them coming from Facebook and Twitter, and you're texting us. Please keep those coming. Dr. Tom Hopkins is here with us to answer those questions live. So really the first one is, what's the difference between the flu and the coronavirus?
First off, there could be some overlap between those symptoms. But when we're talking about COVID-19 or coronavirus infection, it's fever, the cough, the shortness of breath. It's a respiratory disorder primarily. When you think about the flu, it can be things that start off like a common cold.
Right.
It could be fevers, but headaches, body aches are more intense, and less of the respiratory symptoms. So we really focus on the respiratory symptoms as the difference.
And if you have mild symptoms, if you start to feel that shortness of breath, maybe you don't have a fever, but you may have an indication this is happening. Where can you get tested? Can you go to a doctor's office?
Well, first of all, everyone doesn't need to be tested.
Right.
If you have mild symptoms, fever, a cough, that may be cold symptoms, just stay home. Take over-the-counter medications as you need to. Testing is really going to be reserved for those folks who have had exposure to someone with COVID-19, they've been in an area that was high risk, or they have severe symptoms, more dramatic symptoms. Then they need to call their doctor and then be directed to what their doctor tells them or public health officials.
Absolutely. And I know some people are wondering too, this one's from Facebook, can you carry it and not show any symptoms?
Well, it's very rare that people will be asymptomatic and actually have it, but we know, there's a lot we don't know.
Yeah.
But probably so when you think about the incubation period, there could be people that are wandering around, they have it, they don't know it, they don't have any symptoms, and they're placing their loved ones at risk.
Yep.
So that's why we really have to have individual responsibility of helping to mitigate the spread, and that's why you're seeing all this social distancing really happening now.
It really does affect that curve of cases.
Absolutely.
Thank you, Dr. Hopkins. We appreciate your time.
All right, and joining us now is Lori Levy with the Employment Development Department. And of course, a lot of people want to know what's going to happen with their paychecks now that there are big changes to a lot of different industries.
Well, you know, we want Californians to know that there are benefit programs out there designed to help replace wages that people may be losing. You know, that they've had their job, that can't go to work, they've had their hours reduced through no fault of their own. There are some benefit payments that can kind of help provide some of that financial support.
All right, so let's take some questions that we just got from Facebook. This person says, I applied for unemployment insurance, but didn't receive a confirmation email. Did something go wrong? And should I have gotten an email upon completion of applying?
Well, hopefully the person went through our UI online system, and you should be able to get a confirmation number through that. We do encourage people as often as possible to go online. That's the fastest way to get service. And typically we've brought on all kinds of assistance to help us with the claim load that has indeed spiked with this particular situation. But definitely hang in there. You should get some kind of confirmation, and we'll take a couple of weeks to process that benefit payment if someone's found eligible.
Okay, and not everybody has the same kind of employment status. So this question from Facebook, can someone who is self-employed get unemployment insurance?
Well, that's a good question. These are insurance programs, so somebody had to have paid into them on your behalf, whether that was an employer or yourself. There are some self-coverage options. But, you know, it's quite possible that maybe you had a job prior to in the last 12 to 18 months, for example, or that, you know, you may have been misclassified as a worker when, you know, as an independent contractor, and you should have been a worker. So for those reasons, we do encourage people to apply for benefits, and we'll go ahead and look at that eligibility and work with the claimant on that.
All right, so at least apply. We'll see what goes from there.
And we'll work with you.
Thanks, Lori.
And of course, we're going to continue to answer your questions. We have so many more to get to.
For now, though, we want to turn to another big local story tonight. Low snow causing big problems across the Sierra today. Chain controls have been on and off on Highway 80 and 50. Thousands of people have been without power, many since the weekend. Monica, what are you seeing in the forecast? How long is this going to last?
Rain and snow continuing to fall at this hour. As far as our total rain accumulations from midnight to currently, about a half an inch to about 3/4 of an inch of rain just since midnight. And then as we head up the hill, 1.84 inches of rain in the Sonora, especially hard hit the northern San Joaquin Valley earlier today. As far as our 24-hour snow totals, Kingvale, 52 inches of snow, from about 20 to 30 inches of snow for Soda Springs, Echo Summit, Blue Canyon, and even 4 inches of snow in Grass Valley. As I mentioned, rain still falling in some pockets of the valley here. Most of that heading up the hill here, especially on the east side of the valley through the foothills. Snow up top for this year. It's been steady along 80 and 50. A bit more spotty as you head south of Highway 50 along 88 and 89, but certainly still a lot of travel delays coming in from this big low off the coast. And it continues to affect us through tonight and early tomorrow. Winter storm warning in effect through 11 o'clock tomorrow morning. 4 to 12 inches more snow expected. And for the Tahoe Basin, winter weather advisory in place through 11 a.m. tomorrow as well. A lot more rain and snow to talk about in our 10-day forecast.
And next at 6:30, we are answering more of your coronavirus questions. Keep texting them into us at 916-321-3310.
A brand new Hollywood week begins tonight.
We're doing something that we've never done.
With big twists.
You gotta chill out.
And even bigger surprises.
She okay?
American Idol 2-night event continues tonight on ABC.
Hi there. It's Les Schwab Alignment and Brakes and Shocks and Wheels and Tires. Now, some tire places don't offer all that, but we do to help keep you and your family safe. And during the Les Schwab Spring Tire Sale, save up to $160 on a set of 4 select tires. Stop by or book an appointment at leschwab.com. Les Schwab Tires, doing the right thing since 1952.
The rule of 3 states, things that come in threes are inherently more appealing than those that don't. We couldn't agree more. Three SUVs, 1 GMC. Ring in the new year with 0% financing for 72 months on most 2020 Acadia and Terrain models. Plus, current eligible GM owners get $750 purchase allowance.
You can call on me anytime you need. Don't have a reason where. That's alright with me. Just to hear a voice, just to tell a friend. With a single word, we can let the light in. When we say hello, it means
People in this community challenge us to think differently and challenge us to look at things from every lens, and that makes us better. We're always listening. We are not just people giving you the news. We're people that actually really care. We're human.
Closed captioning brought to you by Bell Brothers, your hometown experts in plumbing, windows, heating, and air. Service you can count on for over 27 years. From the No Surprise Guys.
And welcome back. Continuing to answer your questions about the coronavirus here with Dr. Tom Hopkins. Thank you for being here. What are you recommending for pregnant women? Because we did get a question. I'm going to read it really quick saying, I'm 10 weeks along and a nurse at urgent care. The CDC hasn't updated their info in a while. Most data is coming from women who are in their 3rd trimester. So what should pregnant women be concerned about, if anything?
Yeah, well, first of all, they need to just adhere to the same guidelines and everything that we're talking about for asymptomatic patients, and thinking about the same precautions for people who are higher risk. I really would recommend for this person to speak with the GYN and make sure they know their individual risk and what precautions they should take.
Absolutely. It's very good to know. And then another question, I never hear about wearing gloves. Yeah. Would that help? Is that going to prevent the coronavirus?
You know, really just wearing gloves actually is a false sense of security. May feel like you're protecting yourself, but what happens, you're still able to spread those germs. And some people will have gloves on and they think it's okay for them to touch their mouth and their face. And so a false sense of security. And plus you can't hand wash your gloves. Most people won't do it.
Yeah, if you're not washing your gloves, then you're not washing your hands, that's for sure. Right. All right, thank you.
All right, and Lori Levy is joining us once again with the Employee Development Department, and she's really answering all those economic questions that we just are having issues with right now. A lot of people are wondering, you know, they're having problems right now. So they're asking, are you waiving the 7-day waiting period if you have to apply for unemployment or short-term disability due to COVID-19?
Well, that's a good thing. With the governor's executive order, we were able to waive that 1-week waiting period, which is typically there, which means if you became unemployed, out of work at a certain time, and you're found eligible, we'll be able to pay you benefits from that single point in time, rather than having you wait that first week without benefit payments.
All right, so obviously a lot is being done on the legislative level to make these employment benefits more available. People just got to apply.
Got to apply, and there's still developments. There's things happening all the time. We could end up in a situation from the federal government where disaster unemployment assistance becomes available, and that helps the self-employed who are normally not covered by regular unemployment insurance program. So we really do encourage people to apply for benefits, and we'll help you go through that eligibility.
All right, Lori, thank you, and we'll be right back.
This is how you have joy, because you give so much to these wonderful people.
This show makes everybody feel better.
Imagine yourself in a new RAV4, Camry, or Tacoma.
Sweet.
Get ready to turn your dreams into reality.
Hurry in and get up to $1,500 cash back on Camry or get 0.9% APR for 60 months. Toyota, let's go places.
There is a place where the sound so distinct, where winning big spins to incredible heights. Luxury finds you at every turn. The night comes alive and never ends. It's Northern California's premier destination. Thunder Valley Casino Resort. Live out loud.
So I'm gonna hold on promoting you this quarter.
Drop the taco. Get in the car. Does this Sentra feel like a compromise to you? The handling, it's good, right? No compromise there. Nope. Watch this.
Brake.
Clear automatic braking. So if this Nissan Sentra isn't going to compromise, why should you?
The all-new Nissan Sentra with more standard safety features than any other car in its class. Get a low $149 per month lease or get 0% financing for 36 months on the 2020 Sentra.
Geico makes the claims process so easy. I can file and manage my claim all in the Geico app. It's not just easy, it's giving your dog your fitness tracker easy. Ah, good boy. Yes, you got it. Woo! Already got my 40,000 steps today. Can I get a what? No pain, no gain.
It's Geico Easy with fast and convenient claim service.
Look how fast I'm running. Good boy, Chester.
You wouldn't accept an incomplete job from anyone else, so why accept it from your allergy pills? Flonase relieves your worst symptoms, which most pills don't. Get all-in-one allergy relief for 24 hours with Flonase.
Imagine Imagine yourself in a new RAV4, Camry, or Tacoma.
Sweet.
Get ready to turn your dreams into reality.
Right now, get $750 cash back on Prius or get $1,000 cash back on the carpool lane friendly Prius Prime. Toyota, let's go places.
Hey, it's Brett. Join us weekday mornings on ABC10's Morning Blend.
And welcome back. Thank you so much for sending in your questions to us. Our experts will have more answers for you in just a minute. Our Verify team is researching your questions too and helping all of us sort the fact from the fiction during this confusing time. Jason Puckett is looking at viral messages claiming the government is starting a mandatory quarantine.
A viral message and social media post claiming that the government will force us all to stay home for 2 weeks or more. There are multiple versions of this claim online. We're tackling the one we saw most repeated, that the president will be invoking the Stafford Act to quarantine all citizens for 2 weeks. Let's break this down. First, the president has already invoked the Stafford Act. He did it Friday when he declared a state of emergency. Notice how we're not in a national quarantine right now? That's because the Stafford Act only really deals with FEMA. It does allow the federal government to assist states or provide assistance to victims. It does not give explicit powers to the president to quarantine the country. It's not some secret government power. In fact, according to a Congressional Research Service report, it's actually used about 36 times each year to help aid disasters. So the president already invoked the Stafford Act and didn't declare a nationwide quarantine. And the claim that he will do that is only coming from these messages. They don't give an actual source, and we couldn't find any evidence that they are real. The National Security Council, made up of the president, vice president, and other cabinet members, said these messages were fake. Quote, text message rumors of a national quarantine are fake. There is no national lockdown. So we can verify these messages are false. They don't give a source. They reference the president doing something that already happened, and the U.S. government says they're fake. Now, it's worth noting, we can't verify the future. While these texts are fake, it is possible that the government could order a quarantine. There is some legal debate over how the president could do that, and most arguments, like the ones by the CDC, say the state authorities would have to be involved. So yeah, anything could happen, but it's more likely that information about a real quarantine would come from state leaders or the CDC, not a random unsourced text message. If you see more comments like this, send us an email. With your Verify, I'm Jason Puckett.
All right, so Lori Levy is joining us with the EDD right now, and she was just telling me in the break that it's not just unemployment that people can turn to right now. What else is an option?
Well, most Californians are covered by the state's disability insurance program, and you'll see it as a contribution on your paycheck stub, CASDI, and it covers 2 programs. So if you become ill, you can be eligible for disability insurance benefits, or if someone you love, your family member becomes ill and you need to care for that person, or they're medically quarantined, for example, you could be eligible for a paid family leave claim. Those benefit payments under these programs are a bit higher than the unemployment insurance program.
And it sure is nice to know that you have those safety nets that you've been paying into for quite a while now.
Exactly.
So I also want to take a question from Facebook. As a small employer with only access to low interest loans, what will be done to mitigate the huge amounts of overhead we still have to pay without any income because we are mandated to close?
You know, we do have an extension on payroll tax filing and payments. At least 60 days, could potentially go longer, depending upon how the situation evolves. But we do want employers to know that. Certainly, the Small Business Administration has some programs available, and I think we'll continue to see some things rolling out. So I would encourage people to keep an eye on government websites, including ours at the edd.ca.gov, for more information as it becomes available.
Okay, thanks, Lori.
All right. Thank you so much. We're obviously deep in conversation about answering all these questions right now with Dr. Hopkins. Thanks for being here. One we just got in from Facebook, actually one you just texted us rather, is if someone gets coronavirus and they recover, could they then be immune to it, or could they then get it again?
Well, first of all, that's a great question. First of all, Madison, it's less likely they would get it again. Now, there's a lot we don't know about the disease, but think about it as what we do with influenza. If you have a flu this year, you could probably get it again, but you do develop some immunity in the short period of time.
Now, it's something that I think you can really talk about because your practice in Roseville, are some people just not showing up to appointments because of the fear of going to a doctor's office? What's your message to people who may have appointments scheduled and they're like, I don't know, I don't want to go to a doctor's office right now?
Right. First of all, I'm seeing a lot of that.
Yeah.
Folks that have routine medical appointments, they have diabetes, they have hypertension, they're the high-risk folks, but they don't have anything for coronavirus. They still need to take their meds, make those appointments. One thing they could do, call their doctor's office and ask that question, because telehealth, telemedicine may be an option for them, and I've already been using that as well.
Yeah, that's great. There's always options to stay healthy as well. Another question we just got in are people, how are people catching the virus? The plain and simple facts here of just what we know and what we've been talking about a month ago. How is the simple virus being spread?
Spread like the common cold would be, just contact, that social contact, close quarters. That's why we're saying 6 feet away. But, you know, it's being spread by just not good hygiene. So it's important for us to always wash our hands, sanitize areas. And one of the things, Madison, I think the good thing of all this is it's going to change the way that we behave in the future.
That is so true. I know I myself have been washing my hands like crazy. So it's the best recommendation we can do right now. Thank you. Let's get things over to Monica now, tracking, man, oh man, some winter weather.
Oh, you're right about that. And so many of us are in closer quarters because we just can't go out with all the rain and snow. So some good advice there from Dr. Tom Hopkins. Live outside Gilmore backyard right now. It is dry in parts of the valley. Our radar showing a bit of a different story here on the eastern side of the valley, where we're still seeing some rain coming in here. Snow for the Sierra coming down pretty hard on 80 and 50 through most of the afternoon, and south of Highway 50 through 88, 89, most of the passes heavily impacted over the past 24 to 48 hours. A lot of the ski resorts closed down. Squaw empty. Ron saying it was just an eerie sight up there. He owns a condo and was just looking out at the empty slopes for today. Snow coming down in Groveland, about 7 inches there from Herman, sending that into our weather force at ABC10.com. You can also text us 916-321-3310. It's been a chilly day, showery day. Temperatures currently in the mid to upper 40s in the valley, close to 40 for the foothills and close to 30 for the Sierra. Highs today didn't even make it to 50 for some locations, including Sacramento and Marysville. For the foothills, we were close to about the mid 30s to right around the low 40s, and then right about 30 for the Sierra. As far as our water year, we did get some pretty good rain coming in over the past couple of days, but we're still sitting about 4¼ inches to 13½ inches behind where we should be. Timeline takes us through tonight and into tomorrow, showing showers on the east side of the valley and through the Sierra. It's going to be pretty steady through the Sierra until we get to tomorrow morning. Then it starts to break up just a bit, with occasional showers still coming through, mostly for the Sierra, but a hit or miss shower certainly possible for tomorrow's forecast, with the clouds hanging around and the cooler temperatures as well. Highs will only reach near 30 for the Sierra. Winter storm warning continues until 11 a.m. Highs in the foothills 40s to near 50. On and off snow showers then through the rest of the week. It's not going to be real heavy, but we will see periods of some snow showers. Highs in the 50s along the coast, and as we take it inland, again putting us about 5 to almost 10 degrees below average. Our 10-day forecast, we've got highs right around the 50s to low 60s for the next 10 days, with on and off showers. Looks like Wednesday, Thursday, Friday drying out. More rain for the weekend.
It's Brittany Beckley. Join me weekday mornings only on ABC 10.
Life loves sunlight. California sun.
Shouldn't you pay less when you use less data? Now you can, because Xfinity Mobile gives you more flexible data. You can choose to share data between lines, mix with unlimited, or switch it up at any time. All on the most reliable wireless network, which means you can save money without compromising on coverage. Get more flexible data, the most reliable network, and more savings. Plus, get $300 off when you buy a new Samsung Galaxy S20 Ultra. That's simple, easy, awesome. Call, click, or visit a store today.
I can't imagine what it's like to wake up and not have a place to call home. So to be able to share that story and make an impact and have people come to me for more information is like a huge responsibility that I don't take lightly.
Right now, get 0% financing for 72 months or $7,500 total cash on F-150. Only at your California Ford dealers.
This is the look of a 12-year-old cancer survivor. A boy who spent $25 of his life fighting to get a chance at the rest. A boy whose cancer took his knee, but we gave him back the use of his leg.
For extraordinary breakthroughs and everyday childhoods, UC Davis Health offers primary care and specialty care across 17 convenient locations. UC Davis Health, discovering healthy.
Wheel of Fortune, weeknights at 7:30 on ABC10.
Coming up tonight on Late News Tonight at 11.
For a couple weeks, but we do offer our to-go food.
Local Irish pubs making changes tomorrow for St. Patrick's Day after the governor's announcement to close bars, wineries, breweries, and more. We're looking at the changes and why tomorrow could be a big test for the region when it comes to social distancing. That's tonight on Late News Tonight at 11.
And back to answering your questions live with Dr. Hopkins here. What's the difference between Purell and soap? What's better?
Well, they're both equally effective if you really think about it, but the soap and water is to wash off the germs and grimes, and Purell, of course, is to kill the virus.
Right.
So they both do them. If you have a sink, use it with soap and water. If you don't, use Purell.
All right, that's good to know. Absolutely. Another question we just got, which is very relevant for myself. I have 2 dogs. Yeah. Can a person catch it from a dog, or can a dog catch it from a person? What's your comment about that?
Well, my comment about this is, think about this, is your pets are like your family members. So, I think the same kind of precautions that we have of sterilizing our environment, just so be safe, so your pets won't be affected as well.
Yeah, that's great to know. I know there's a lot of questions when it comes to this. We are going to continue to answer your questions live on our show here, but also just in person. We're going to get those links sent to you all because I know there's hundreds of questions coming in, so we appreciate your time.
And as we have established right here, it is hard to keep this social distance that everybody tells us that we're supposed to.
Right.
We're trying to do a show for you, but at the same time, of course, we're trying to establish these healthy distances that the CDC recommends. And a lot of good advice that we heard tonight. A lot of people have a lot of anxiety when it comes to medical issues, when it comes to economic issues. And what did you think about some of the medical advice that you heard tonight? Did you know all of this, or did it kind of come as a surprise?
No, I think there's so much misinformation out there when something of this magnitude is happening in our world, in our country, in our cities. So, there's a lot of misinformation, but having the experts on and answering your questions as much as we can to the best of our ability is super important to us. So there's a lot I learned tonight.
There sure is. We'll see you tonight at 11 o'clock. Have a good one.
Good night.